that. I think that. All right, let's do it. Thank you. Okay, so welcome to our July SRC meeting. We'll go ahead and begin. Thank you, everyone, for being patient as we work through some bit of technical difficulties, and also thank you for attending this meeting after it was rescheduled from last week due to the 4th of July holiday. Um, I don't think we have any new people today. Everyone seems to be familiar or have at least attended the meeting to know who's all in the room and a part of today's meeting. We may have some other people joining us as we move forward, but I think that we can get through this within the next 30 minutes or so. So we'll start with committee updates. And if you have on the agenda for the Consumer Empowerment and Advocacy Committee to go first with their updates, and then Policy Planning and Review Committee, then the Nominating Committee, and then our Media and Public Awareness Committee, which we are still looking for a chairperson in that on that committee. So I'll let you guys take it away.
Sure. Hi, everybody. This is Susan Brooks with the Consumer Empowerment and Advocacy Committee. We met last just 2 weeks ago, and we had been working on a survey, and we've run into a few barriers in disseminating that, or it's gotten pushed back. But in this last committee meeting, we also talked about kind of updating our committee charter to more accurately reflect the work that the committee is doing. And we also discussed having a presence and what would be necessary to have a presence at the Employment First Summit, kind of manning a table there, introducing people to the SRC and our committee so that folks are familiar, so that when we are speaking to people or sending out surveys about, getting feedback from folks, that people are familiar with who this committee is. So those are some of the things that we've been working on for the past month.
And just as an update, which I haven't shared with the committee, but I have talked to Dr. Austin about maybe possibly seeing if we could get information, flyers, or cards about the SRC, as we stated in our meeting. And then there might be a potential for us to get maybe a website. No promises, but that is something that I brought to the attention of those that be. So I'll hopefully have an update coming at our next meeting.
That's wonderful. And one last update I forgot about to mention is that, the SRC is also providing, interviews and information for the statewide assessments group. And so I believe I had my meeting with that group, and I believe Chloe did as well.
I've had mine as well.
Yes, great.
Okay, Rachel, you want to start us off with the policy planning committee updates? I just added you to that from what we talked about yesterday.
Yes. Good morning, everyone. So I just wanted to give an update on the RSA side about where we're at. We had several documents with the SRC policy group, one being the intake SOP, the RSA due process policy, and the RSA case transfer policy. Yesterday, or maybe the day before yesterday, Chloe, I shared with you the RSA case transfer procedure and the edits that we made for that. So whenever we can schedule some time, the policy committee to go through those changes we made would be great. We are still working through the intake SOP and ensuring the language matches what's going on within the new system. And also with the due process policy, we are still working with OAH about establishing the MOU, MOA. I can't never remember the difference between the two, but I know it's one of those. And then getting that language included within the due process policy.
Great. Thanks, Rachel. Yes, I received the case transfer policy. I think it was yesterday. Um, so we will be scheduling a policy meeting to go through those changes. Individually, I've been working on the bylaws and wanted to, kind of get some of that started before having a policy meeting about that. Also based on some conversations in the Consumer Empowerment and Advocacy Committee.
Okay.
So that's what we've been working on. But do you have, Rachel, like an estimate on the other two that are in process, the intake? I mean, due process, obviously, that's going to take some time if the MOU or A, I honestly don't remember the difference either, is in process. But for the intake SOP, just wondering if we should schedule a meeting.
Um, so my goal for myself is to have that back to you by early August.
Okay.
Yeah.
So maybe we'll have a meeting to talk about the intake, or sorry, the case transfer since we have that one from yesterday. And then
Mhm.
we could start on the bylaws too. So I'd also
Okay.
like to get input from each committee on their portion of the bylaws and kind of re-looking at what they want their main focus to be and making some of those updates. So that's my plan for the bylaws as well, is to um, either meet with the heads of the other committees, although I think we're missing a head of one of the committees. And maybe the nominating committee could work on
Mhm.
finding a new head for the other committee. I'm actually not sure if that would be their role. Um, but at least talking to the other two heads of the committees about those portions of the bylaws. And then I've made a lot of comments on the bylaws just based on conforming with the federal regulations. I know Nalika has looked at it over the past couple years. Um, but Rachel, I don't remember if I sent that updated with the regulations language bylaws to you
I don't
for
remember
Nalika's
receiving
review.
that, so could you send that to me
For
again?
sure. Yeah,
Yeah. Thank
yeah.
you.
So yeah, that's what we've been working on in the policy committee. So we'll be having some more meetings shortly, and then hopefully really getting moving on the bylaws. That is my priority right now
Okay,
for that committee.
great. Thank you.
Thank you. I don't think we have anybody here from the nominating committee.
Just me, but I don't think Allison is on.
Okay.
But we actually haven't met, since our last meeting. One thing I did do since our last meeting is I did email, Mary from the Mayor's Office of Talent and Acquisition and sent her our list of folks and their respective designations. In a previous conversation with her, it seemed like there were people on in the SRC that may not have been in the SRC. And vice versa. Like, so our lists weren't aligning. So I'm still waiting to kind of hear anything back about that. But I think that was kind of a good starting point for us to really see who they have in the system as active, based off who we have, and then for us to learn about what designations are vacant. And that can help us determine how we recruit, because many folks on the committee, I think they have nominations that expire in 2027. So we want to try to be proactive. But I also agree with Chloe that we probably should meet and create a list of voting members versus non-voting members to streamline some of the front end of our meetings.
Hi, this is Michelle. I wanted to say I'm here. I'm on that committee, but you're absolutely correct. We haven't had a meeting recently. Thank you.
I can reach out to Allison too to help with scheduling. I know with Charlize's change in role, it's more up to us to kind of do that. I'm also happy to schedule, but I know she's the chair, so maybe we can all get on each other's books within the next, week or so.
Okay, thank you. And as you all know, we are still in the process of finding a chairperson for the Media and Public Awareness Committee. I've asked a few times if there was anybody interested. However, and I have not received any responses to that. So again, I'm throwing that out there. If anybody would be willing to step up and be the chairperson. There are a few pretty good active members that are part of that committee. So, we can all help each other out if there's anybody that would be interested in doing so. You can always send me an email, so please feel free to do that. And without further ado, we'll move to Brittany for the update for the CSNA status update.
So we did have a status meeting yesterday. The main thing is that our contractor Promesa is reaching out to all of our informants. So it sounds like some of you have already been outreached to, and they're hosting their group meetings and one-on-one meetings to gather information. Now, the biggest question that we're still waiting on is when the survey will actually be launched. Our contractor is working with San Diego State University, who is a VR Tech certified organization. And there are a few aspects of the survey that still need to be approved by the VR Tech certified organization. And so that is causing a bit of a delay for the actual survey to be deployed. From our status meeting yesterday, he didn't seem like too worried about that timeline. However, I know we introduced the CSNA so early and for some folks, we even sent kind of the initial outreach to. And so we just have to be a bit more mindful that some folks may have tried to complete the survey and were unsuccessful because it wasn't quite launched yet. So we're hoping to still capture those folks by outreaching again. They are using a type of AI support with their outreach and deployment of the survey. So I do believe that they'll be successful with recapturing the audience that received the initial outreach letters. But that's kind of where we are. And hopefully next week, I will get an idea of when the server deployment will be ready for, we'll be ready.
Okay, thank you. And next on our agenda, we have just an update from Dr. Austin.
Here I am. I had to shut the door. I could hear pots clanking in the kitchen. So I didn't want you guys to hear that. So pleasure to be with you guys this morning. Just had a couple updates. I want to give you an update on RSA staff hiring. We recently completed a few rounds of hiring for our VR specialist positions. We have selected 2 candidates for the transition unit, and we have two remaining that we need to hire for. And then we have selected 4 VR specialist position for the general VR. And we have two more, one a VR specialist and a rehab assistant that we need to hire for the VR general. Offers haven't been extended to everyone, so we're hoping to extend a anticipation date and hoping that they accept our offer. But we will keep you posted with that. Um, with the Randolph Shepherd program, we need to hire a program monitor and a staff assistant. We had one that just recently took another offer, the assistant. So we're going to have to fill that position. So we are in the process of doing that also. Um, So we have a lot of stuff going on here. Plus, with the staff between February all the way up to, I guess, May, we have onboarded several positions. So a lot of those folks are kind of getting up to speed. One of the individuals I really want to uh, point to is Latoya. She is our trainer specialist, so she is in the process of really trying to develop a onboarding system for a lot of the staff that we're onboarding within RSA, and then hopefully we'll be developing a training calendar for RSA. So we're kind of like in the thick of really doing a lot of planning for that to make sure that our staff are up to speed and are understanding policies of that are in place, but those that we're currently updating at this time. Um, the next update is we just recently had a provider meeting at the end of June, and we are reissuing authorizations for job development milestones for the agency. So those individuals that are currently job ready, we are reauthorizing for 3 milestones for job development. Where historically it would have been non-billable hours for those individuals that were, if they've already worked with them, we're trying to incentivize that for the providers, but also that they would re-engage with the individuals that we currently have in our system, so we can get these individuals placed into employment. We are in the process also of um, finalizing our contract with our case management system Inform. Um, with that, we're looking to potentially do some enhancements that are going to be a benefit to our staff and our customers. We are some of the enhancements that we're looking at and will be getting would be what they call DARE 911. It is a system in which it identifies errors in our 911 report to help our quality assurance folks to do our reporting. Where right now it's, they're doing a lot of the stuff manually, so this is really going to help support them internally. Probably a big update or enhancement that we're going to be adding is called Sarah. It is really a software solution to help with engagement and compliance within the agency. It allows us it's going to allow us, one, to engage with our customers through their phones. And so, uh, with doing that, they're going to get messages on their phones. They're going to be able to do signatures on a lot on the application, on the IPE, any consent forms, appointment reminders, follow-up, anything that we may want to do with like events, like we have job fairs or group sessions that we may have. It's going to have the capacity to engage with our customers more frequently and give us the necessary documentation where there probably is an administrative lift on our staff to do case management. Some of that stuff is going to be created and kind of automated within our case management system for them to do their case management. So this is going to be amazing for our staff and for customers. Uh, secondly, secondly, um, the third item would be the National Student Clearinghouse. We have a requirement within the agency to look for credential attainment and MSG, which is measurable skill gain. The National Clearinghouse, they're able to get the data from high schools, colleges, universities on high school diplomas, degrees, certifications. And so this was going to help with the tracking of some of those things where we're trying to track down from customers. And it's very difficult when they're in that last session to get some of those things. So this is going to be a data pool that will be able to help us to document all the work that we're doing. Because I'm convinced, just like several other VR systems across the United States, we're not really reflecting the fullness of what we're doing as an agency when it comes to all the work that's going on. We literally have one of the most complex grants that we're implementing. So this is going to help us to have the necessary documentation that we need to reflect all the work that's going on. And then the last thing that enhancement that we're going to be looking to, which we've already procured, but it needs to be interfaced with and informed, is the Social Security ticket tracker. So any individual that is currently within our system that is receiving SSI or SSDI and they have a ticket to work, we will be able to track them for any type of reimbursement in the long term with them. And then as they're closing up out of our system, then we are able to get reimbursement of funds through Social Security for the agency. So that is the last enhancement that we're looking to do. We have been in the midst, as I've told you guys before, we just recently received the Neon grant. So we have received it before, but this one that we put in January, it really focuses on the agency supporting individuals with co-occurring disabilities, with mental health, where they're accessing career pathways in high demand industries and across career and technical training programs. So we're going to take this first year. We did receive it along with, I think there was 8 other states. Um, and this cycle from March all the way to August, we have already connected with subject matter experts in key areas. Um, we're looking at the labor market data and trying to project areas where there's most need. We have July 20th. We're going to have a World Cafe, and various stakeholders have been um, invited to that. We're trying to get a mix of consumers, providers, key stakeholders, employers to really kind of get their feedback as part of that event. It's going to be like just a half day. And I think at Gallaudet, is it the Kellogg Center? I think it's the Kellogg Center, where it's going to be done at. And there's going to be a lot of roundtable discussion at that, covering just key topics to get insight from the various stakeholders. And then we're also trying to identify opportunities and increase engagement with the workforce initiatives that are going on with job seekers, service providers, and employers so that we can really increase our outcomes with individuals with mental health and co-occurring disorders. Um, the other priority that we're really going to be focusing on as we do our strategic planning also has to do with how do we do sustainable cross-agency planning and infrastructure so we're not duplicating services across the district, but really kind of coming on the same page where we are, one voice, one sound, in trying to implement services that have mental health. So that is my update on the NEON grant, but I'm real excited where we're going with this. Then we have some other kind of things that are kind of emerging as we look at over the next 3 years of what it looks like in this space. So we're going to also be trying to tackle um, um, benefits counseling is on the short list, and really identifying any policy changes that we would need to look at in this space, and then trying to tighten up our current individual placement and support and evidence-based employment with the Department of Behavioral Health to kind of tighten that up and increase the outcomes of what we're currently doing with them. And I think that's all I have today. So thank you so much.
Thank you. Are there any questions or any announcements from anyone else or anything that anyone else would like to share?
Dr. Austin, do you know if everyone on the committee received an email or I guess it would only probably be an email regarding the upcoming World Cafe?
I'm not sure if everyone received an email, but if you let me know that you're interested, I will send it. I know we have like 70 slots. And so there's several people doing, kind of doing invites. Like I have someone doing employers, and then we have some of Crystal's folks doing um, in that unit, they're emailing folks and trying to identify. But if anyone is on the call that is interested in partaking of the cafe, just let me know, and then I can send you an invite because I know we have a limited amount of spots, and they're trying to coordinate like a diverse group. So we have individuals with disabilities that are invited. So just let me know, and then I will try to get that out to you today, so you can register.
And I think that's an excellent idea. I was also wondering if anyone on this committee would know, of individuals who have co-occurring needs that might benefit from participating. I know they did push out the. I know I shared information with our providers, but I'm not exactly sure what the outreach is for district residents. So anyway, I just thought maybe folks in this meeting might know other individuals who could benefit from participating. But thank you for that, Dr. Austin.
Okay, if there are no further questions, I think we can conclude today's meeting, and we will readjourn. Our next meeting would be in September. Please, if you have any other questions, you can always reach out to me, or Brittany, or Dr. Austin to get those questions answered. So thank you again, and I hope you all have a great weekend.
Thank you.
Bye. Thank you.
Thank you.
Bye, everyone.
Thank you. Bye.